We are speaking with Joshua Joseph, a mental health counselor and a clinical hypnotherapist with South Florida Integrative Medicine. We are speaking today about cognitive behavioral therapy. What is that?
Cognitive behavioral therapy is a theoretical orientation that we use with our clients that combines both cognitive therapy and behavioral therapy, so how we think and how we act.
Okay, and with COVID-19 and everything everyone's dealing with, how does that play into this?
Great question. So typically we look at how our thoughts are connected to how we feel and how our feelings lead to certain actions or behaviors. So thoughts, feelings, behaviors. And so while we're at home with coronavirus or COVID-19 in the world, right, and self-quarantining and social distancing, we may have feelings of anxiety, for instance, to pull at one of the many emotions that we might be feeling out of a hat. And my job as a therapist, for instance, might be to look at what thoughts are leading to that anxiety. Let's say the thought is, when am I going to be able to get back to work? And the uncertainty is making me anxious. And so my behavior, perhaps a maladaptive one like substance use, could increase. I might see an increase in substance use, like I might be drinking more, I might be smoking more, etc. And so my job would be to help focus on what the thoughts are that are leading to the anxiety and see if we can break it off at either the feeling or the behavior and instill something new, something different. So an example of that might be, well, if I'm not in control of when I'm going to go back to work, for instance, that's what's making me anxious, then perhaps we should focus on what it is that I am in control of, like cleaning my house or baking. And we might notice that after issuing some homework, like, how about you bake this week just once, or clean the house just once? We should notice a slight decrease in the substance use, for instance, and therefore a subtle decrease in the anxiety as we start to have more control in an area in our life.
So it's really about finding what is causing the problem and finding something else to address and fixing it, right? So you might not be able to control this, but you can control that.
Absolutely. And I think you're touching on a really important subject, and that's awareness, becoming more aware of what it is we're thinking and how that's connected to how we feel and how we act.
Okay, great. Cognitive behavioral therapy. This is Joshua Joseph, a mental health counselor and clinical hypnotherapist with South Florida Integrative Medicine. Thank you so much.